Officials continue to keep a close eye on measles cases across the U.S. now less than a week after Kentucky recorded its first case in an adult.
Unlike Texas here, doctors say that Kentucky's not currently seeing any signs of an outbreak. But as Wave News reporter Alina Noakes tells us, seeing any cases at all, that is what's concerning to doctors.
Well, that Kentucky case comes with the first measles-related death of a child in over a decade amid an outbreak in Texas. But health officials have already made efforts to address it, putting at bay any concerns that Kentucky is seeing an outbreak of its own.
Lack of transmission of the measles in Kentucky is an encouraging sign for officials watching the rising cases elsewhere, but the concern is still at a high.
Given that there is an outbreak, a fairly large outbreak in West Texas, and the world has become a much smaller place, and people travel quite frequently, the potential is certainly there.
The uptick in cases comes at a bad time seasonally, especially in a century that has not seen many cases.
It's not something we see very often, and the first symptoms of it are very generic. And right now we're in respiratory season, so they come up as fevers, chills, really bad runny nose and cough and congestion.
The red rash that quickly follows is the giveaway, flat red bumps setting it apart from pox-related rashes.
If I had measles and I was in this office, even if I left this office and someone came in within an hour, there's a potential they could get infected as well.
But the highly contagious disease is tempered in the U.S. by a highly effective vaccine.
And this will be the message for every age range of people. Try to get a hold of your shot records.
Dr. Nicholas Van Sickles says a lesson in history best helps people understand their level of protection, starting in 1957.
So we look at 57, before 57, protected by just the prevalence of measles and how easily it spreads. 63 to 68, a little bit of a gray zone. We had a vaccine that wasn't as effective. 68 and 89, you probably got one dose if you were born here and got your childhood vaccines. And after 89, if you got the childhood vaccines, you should have gotten 2 doses.
Now, doctors say 2 doses of the vaccine provides the best protection, and a mask can also help prevent transmission. Alina Noakes, Wave News.